I chose my presentation to be on opioid use disorder. The criteria to be diagnosed with OUD: you must have at least 2 or more. Impaired control, physical dependence, social problems, and risky use. OUD is defined as a problematic pattern of opioid use leading to clinically significant impairment or distress. DSM-5 coding is coded off of the severity of all the symptoms. There's mild, moderate, and severe. Symptoms of opioid use disorder. Physical symptoms would be needing more medication to get the same effect as experienced withdrawals when the substance is not available. Psychological symptoms. Substance dependence overtakes all other priorities such as work, school, well-being, or other obligations. Lying about pain to receive prescriptions for opioids, making appointments for multiple different doctors to receive multiple prescriptions for opioids, poor performance in work, unexplained periods of absence, and isolating oneself from friends and family members. One of the famous cases is Robert Downey Jr. This was him before, when he was in active addiction. This is him after he got sober. Robert was introduced to substance abuse at an age of 8 years old by his parents, who were users as well. Throughout his teens and early years as an adult, he dealt with addiction with heroin, cocaine, alcohol, and prescription medications. This led to multiple arrests and eventually going to prison, almost losing his career altogether. He was court-ordered to rehab, where he got sober after many relapses, and learning from his mistakes, he started getting his life back together. After rehab, he had a comeback in his career and has been fully committed to his sobriety since 2003. Diagnosed along with OUD, chronic pain disorders, other substance abuse disorders, depression, anxiety disorders. Mistaken for OUD. Bipolar disorders, including bipolar 1 and bipolar 2. Depression disorders as MDD, and mood disorders. Some symptoms of opioid intoxication: respiratory distress, depression, pupil constriction, drowsiness, slurred speech, impaired attention or memory, euphoria, dysphoria, psychomotor agitation or retardation, impaired judgment. Signs of opioid withdrawals: pupil dilation, sweating, dysphoric mood, nausea and vomiting, muscle aches, diarrhea, vomiting, yawning, fever, and insomnia. Opioid use disorder treatment. Medications are first-line treatments such as methadone, Suboxone, or Subutex, and Vivitrol. Substance use can start from anywhere from trauma, having fun on the weekend, to an injury. Most people do not choose this life. Once it starts, it's hard to get away from. It takes a lot to walk away from addiction, and most people don't get the chance to walk away. Have empathy for addicts, active or recovering. You don't know what they've been through. Hopefully, you can be the difference that helps them want to get better. Remember, one day at a time.